afternoon, friends. I'm Dr. Aashish Phadke from Mumbai. Uh, Today we are actually going to have very interesting discussion. Point, which is the theme on which I have been invited and about to speak, is on Sattvavaje Chikitsa, Daivyapashraya Chikitsa, and whether they are required or alone Yuktivyapashraya Chikitsa is enough, and then the relevance of them in mental health, and then some part on Ayurvedic way of immunization. So that is what is the entire canvas of what I'm about to speak today. uh, I would like to give this presentation along with the slides so that it will be really useful to read some of the references directly from the text as well as from different papers, research papers, and other sources. Our topic today is Sattvavaje Chikitsa, the Vyapashraya Chikitsa, and its relevance in mental health. And the another subtopic or the other topic to be discussed is with reference to immunization, concept of immunity and immunization in Ayurveda. But I'll be giving more thirst and I'll be speaking a little more on these two and even on mental health to some extent. Before starting, let me introduce myself in a brief. I have done my BMS and MD from Mumbai University. I was a rank holder throughout. Then I pursued my MIM gold and I received gold medal in that from Pune. Then I also did MS in psychotherapy, MA in philosophy, majors in yoga, then advanced diploma in yoga, then diploma in yogic education. And in the meanwhile, I started doing my PhD program around way back in 2015, and I completed that. That was in yoga again, and the topic was, critical examination of concepts and practices of yoga with special reference to test anxiety of students, because I've read somewhere that every day in Maharashtra, 8 to 9 students they commit suicide, and then it was a triggering point to think very seriously whether should can we contribute to this from Ayurvedic or from yogic point of view. Particularly from yogic point of view, I started working and I completed this particular project last year itself. So I did PhD in yoga. Then I have also done my qualifications in ophthalmic sciences. Then I have done DBM, DMM, then Sanskrit, diploma in Sanskrit, diploma in German, music, and several other things. And also I covered certain specific certifications, particularly important to mental health. For example, I have done clinical hypnotherapy program. I have done biofield viewer program. I have done certified stress management personnel program. Also, I have done REBT, CBT, life coach program, and things like that. Why I have gone for all these things? That must be the question in most of your mind. And I think the only answer which we can give it to this is what our Sushrutacharya has mentioned way back, that ekam shastram adhyano na vidyat shastranishcham. Tasmat bahushrutam shastram vijaniyahat satu chikitsaka. So if you want to address or if you want to analyze any particular problem, then you should not alone be in particular discipline, but you should be well versed at least. I'm not saying that you become master, but you should be at least sensitized to various disciplines so that your view gets widened, your view gets open, and then you can look at that particular problem in a much better way. There is another, nyay which I recollect at this juncture of time, and that is Karatala Amalaka Nyay, we call in Vedanta. So if you keep a Amalaki fruit, and if you try to look that fruit from this side, so I'll be able to see only this part of that fruit. I will not be able to understand what is the other side of that fruit. Like for example, now we are trying to explore moon, and our Chandrayaan is about to go to the other side and about to find out what are the things over there which we can't see. But if you take a bird's view and if you can see 360-degree angle, if you know different disciplines and if you try to understand similar problem, one problem with different approaches, then I think we can in a better position to understand the depth of that problem, and we can help our patient in a much better way. Actually, my patients were the one who motivated me to learn more and more. My students, my patients, I was teaching in the Ayurvedic college for more than around 10 years plus, and there also you require to be updated, because anytime any question can be fired from student side, and if you really don't know, then it is not correct. And that time, rather than fooling students, it is better to say that sorry, I don't know at this time, I will study back and I'll then answer. And that was my approach all the time. But because of patience, because of students, because of all my gurus, those who have taught me in all different disciplines, and my parents, because I come from a family of Vaidya, right? My dad, mom, both were professors in Pudar Ayurvedic College, Medical College, Mumbai. My mom wrote some books on Rasa Shastra. Daddy was professor in Rasa Shastra. So there was a tradition, lineage in my family. My grandfather and even great grandfather, they were also from Ayurvedic side, from Nasik. So actually, all these things have helped me and they supported me to learn more in the field of Ayurveda. So right now I am having my clinics at Mumbai and Navi Mumbai. There's a twin city, that is New Bombay. And I have got my clinic with the name Dr. Aashish Phadke's Ayurvision Center for Ayurveda and Panchakarma Therapy. And I'm also working as an honorary deputy director at Division of Endocrine and Metabolic Disorder, Kasturba Medical Health Society, Medical Research Center, Mumbai, at Villeparle West. Apart from that, I'm also teaching at various institutes Ayurveda which are not Ayurvedic institutes. For example, I teach at bioanalytical students, MSc bioanalytical. So to them, I teach Ayurveda and certain things pertaining to Ayurvedic standardization and things like that. I teach to pharmacy students. I teach to MSc postgraduate students of food and nutrition or clinical dietetics, clinical nutrition and dietetics. So basically, when you approach to these people, your explanation, your way of explaining about Ayurvedic concept has to be in their language so that they will be able to understand the concept. And then we can develop, we can modify, and then we can utilize in a much better way. So with this brief introduction, I would like to go ahead with our slides. So first, as we usually do, that I would like to give my pranams to Lord Dhanvantari, and this is the statue of Patanjali, right? The one who has written Yoga Sutra. So why Patanjali? Because when we are dealing in mental health, then we have to take a resort to yoga as well apart from Ayurveda. So I'm bowing in front of either Avir Babu Kalasham Dadadajnavadyam Piyusha Purnam Amaratva Krite Suranam Rukjala Jirna Janata Janita Prashamso Dhanvantarissa Bhagavan Bhavikaya Bhuyat. And Yogena Chittasya Padena Vacha Malam Sharirasya Cha Vaidyakena Yopakaruttam Pravaram Muninam Patanjalim Pranjali Ranatosmi. So after bowing to these two, let us go ahead. Now, in our brochure or in our communication, they have given particular question that is Yuktivyapashraya Chikitsa, including Panchakarma, sufficient for a complete practice? Question mark. Then the second question was, are Satvavajan and Devapashraya Chikitsa relevant today? Okay. And then, is there any relevance of Devapashraya Chikitsa and Satvavajan Chikitsa in contemporary healing? So these three questions were posed. Now, if you look at this particular question, is Yuktivyapashraya Chikitsa sufficient for a complete practice, or whether it is relevant, or whether it is possible to utilize them in contemporary era? The reason I can see very clear, because in our educational system, when we learn in first year or in final year, whenever we come across the divisions and types of chikitsa, types of treatment modalities as mentioned in Ayurveda, then we definitely speak about these three. But then ideally we see that most of the time people are using only Yuktivyapashraya at large. Now we'll see what exactly Yuktivyapashraya. I know all of us, we are aware of it, so I'll not go for repetition of the reading out the shlok, but I'm just showing those particular references for the sake of betterment. But coming down to this, my question is why this question has been posed, that is Yuktivyapashraya sufficient for complete practice? That means they have got question in their mind that it is not complete. To me, it sounds like that. Because in practice, we see that certain times, in spite of having exact diagnosis, in spite of taking a lot of efforts in understanding what is the dosha dusha samurchana, what is the samprapti, what are the hetus, everything is considered to be close to or exactly pinpointing. You choose the drugs, whether it is now in chikitsa. We also have another classification, not classification, but same saying that Ayurvedic chikitsa is what is basically correction of agni. Kaya chikitsa is the correction of your agni. That is what kaya chikitsa. And within that, you have got first, component is ahar, then vihar, and then aushadhi. So usually it needs to be corrected at the level of your ahar, your dietetics, then your daily routines, dinacharya, rutucharya, all that, or swasthavritta, lifestyle management basically. And then sometimes in bracket, some people they add along with vihar, vichar also. So what kind of thinking process, what kind of thoughts you have all the time, and are you working on that? And then it comes to aushadhi. And on aushadhi, when we speak, again, then there are classification which we'll see later on while discussing about Yukti Vyapashraya. But these are the things. But in the practice, in our clinics or in our institutes, when we are teaching to students or when we are actually seeing patients in our own private clinics or in the hospitals, usually by and large, it has been found that people are using Yuktivyapashraya only maximum. But don't you agree with me that sometimes you use everything correctly, you give proper medicines, you give proper dose, you give proper rasaushadhi or proper kashayam vata, and still patients are not getting rid of their problems. You may use panchakarma as a shodhana, you may use external or internal applications, and still no results. And then you start scratching your head, ki, what is happening, what is the problem? And then sometimes you get to know, or you get that vision, oh yes, probably this particular person is having psychosomatic origin, not just somatic. So you start working on psyche part of that patient, and then you see, after having certain techniques which we'll anyway see in sattva vajay later on, and you start observing the changes in the symptoms which you were not otherwise observing even after giving n number of drugs. So that particular point you realize that yes, there is a need and there is a utility of sattva vajay even in today's context. Okay, sometimes even after using sattva vajay and yukti vapasya together, still you are not able to decode the problems. And in such time, in my home, in my practice, usually used to sit with my mother, and she is, as already I have mentioned, she is also Ayurvedic physician, and she is also very good astrologer, medical astrologer, and she has started learning astrology from her age of 18, and now she's 80. Okay, so many years time she's putting into learning and utilizing, applying astrology also. So in certain cases, we see or we ask that patient to get the natal chart, the patrika, the kundali, and when we see that such kind of things are happening, that it is not actually giving any changes, then we ask to see the patrika, and from patrika, from the positions of particular planets or constellation nakshatra, you get some clues. For example, we also aware that there is a nakshatra vriksha, aradhya vriksha, And those Aradhya Vrikshas are most of the time they are from our Ayurvedic compendia, right? So Ayurvedic Nigantus. So we are aware of those. Now, what has been seen, what I have learned from other seniors and other stalwarts in this particular field, including my mother, that if you include some of the pudi, some of the packet having one of the component of this nakshatra vriksha of that particular patient, makes the difference. Or there are certain prashchittas, there are certain kriyas to be done. For example, you take a round, say 100 times round. In the text, it might have said that 10,000 pradakshina, but it is not practical. So practically, we say that okay, whatever you can make a niyam. Once you make a niyam that I should make 25 rounds, so stick to it and please do it regularly. So by doing that to say Shami Vriksha or so Pipal Vriksha, or whatever it is, or Tulsi, then we have seen that there is changes, and those things you cannot actually logically or rationally show why it might have happened. Sometimes still we can work on it, we can decode it, and we can speak about the rationality of how it might have happened, but most of the time it is due to the prabhav, right? So that is what we come to area where even Devyapashraya can also be utilized in our day-to-day practice. Now, there are certain plus and minus part about this, which we'll discuss after discussing Devyapashraya or even after discussing Sattva Vajay. But this is what I think the answer which I have to give with to these three basic questions, that is it relevant? Yes, it is relevant. Is it relevant in contemporary healing? Yes, it can be done. But then it can be also clubbed with whatever new techniques, whatever new knowledge system, what we are having to our benefit. We should make an effort to come out of the shoes of only Ayurvedic framework and try to learn that, and then you amalgamate those principally, not just integrated. There are two things: one is integrated and one is integrative. So integrated means you have got allopathic diagnosis and you use only Ayurvedic drugs. So that is integrated approach. You use some tests and you confirm the, oh, this is this particular diagnosis, and then you use our medicines which are being prescribed in that particular chapter. So that is integrated. But when integrative term comes, then you should understand the conceptual level, you should understand the depth of that from the both, and you try to amalgamate rather than having any bias or any quarrels between two systems. We should find out how best way we should able to utilize these two or three or many systems for the benefit of our patient and for the benefit of our Ayurveda as well. So that should be the approach I particularly feel. Now, uh, going ahead, then what is the importance of building manas swasthya in health? That is another question. Now, I think that question is slightly irrelevant because when we speak about swasthya or swastha concept in Ayurveda or even in yoga for that matter, so in Ayurveda, the very famous definition given by Sushrutacha, Samadosha, Samagnisha, Samadhatu, Malakriya, Prasanna, Atma, Indriya, Manah. So first line, that is Samadosha, Samagnisha, first line, that is for physical plane, and the second line obviously speaks about mental plane and spiritual plane. So not alone manaswastya or manaswastya, it is also adhyatmic swastya also, spiritual health as well, well-being also, right? So does Ayurveda have an equal effective immunization as Western vaccination? Again, I think this comparison I don't think one should do, but certainly Ayurveda do have a great mention about what is immunity, to which we all know with the term Vyadhik Shamatva, and there are various ways and means with which it has been mentioned, and it is more holistic rather than reductionistic approach as specified by modern or Western medicine or biomedicine. So I try to identify a particular microbe, and then they work on that, and then they create vaccine, and then you inoculate that vaccine, and you create that active immunity, and then that's how it goes on. But here we are trying to boost up the host, and then it should happen that even though at this given moment, all of us, if we have been taken samples from our blood, then we will see some presence of M. leprae or M. tuberculosis and whatnot, and still we don't have any diseases. Why it is not happening? Because our immune system is at par and it is fighting with those external microorganisms which are pathogenic, and it is not allowing them to crop up, right? So that can exactly possible if we have got a holistic approach. As we have been saying in Ayurveda, we have got something like swasthavrutta, rutucharya, dinacharya, and it should not remain to just textbook, but it should be able to get application in day-to-day life in ourselves first, as well as we should able to teach to our students and then finally to our patients. So once they start following that, then slowly and steadily they see how it is important, how it is able to prevent not just one or two infectious diseases, but also it works better on NCDs, non-communicable disease, which is again a big task for worldwide. So I think Ayurveda can address to that as well. Now I am picking up some questions from the other themes, other groups, though it is not mentioning in our theme, but I was really happy to see this question. Is evidence-based research in Ayurveda a global necessity? Yes, very much. Why global? We should start from local. We should able to establish some evidence base, and we should able to create some protocols, and then slowly we can utilize those protocols nationwide. And then once we have got a data, a large data, right, whereby thousands and thousands of people are using particular method in Sattva or say some of the simpler methods in Davyapashraya, Yuktivyapashraya, so anywhere it is happening day in, day out. So if we can collect this data on a primary level, and then we can write good papers. What I mean good papers, you all are aware what I mean good papers, following the criteria of the scientific fraternity all over. And then when it is getting published, not only in our journal but also journals from outside, and they should get compelled to publish our papers, because by that time there is a lot of discussion on this particular topic, whatever is happening in India. And now some of the our colleagues must be saying, though, oh, Dr. Phadke, it is not easy, it's very difficult to get published in their journal, because they don't accept the moment you put Ayurveda term, then they reject. But I know I have had experience with one of some of my MPharm and PhD students when we were working together with their guide, and we have sent paper to very good journals like Phytotherapy and Journal of Ethnopharmacology and things like that. And I insisted that you kindly mention the shloka in Sanskrit, then we will have transliteration and we have translation, and then we will give interpretation. So the guide of that student said, no, 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 this is not possible, because this is a journal from modern pharmacology, ethnopharmacology. So no, no, this will not be possible. I said, okay, fine, you go ahead. And then when they sent their manuscript, then it was having some queries, and they said it doesn't have any proper, like history and how we can trace it out and things like that. Then I said, let us now follow my formula, let us put the shlok and let us send it across. And then the editorial board replied that, oh, we were not aware that this is having this kind of history. But sir, sorry to say that we cannot publish Sanskrit. You can just mention the English part of it, and then we'll accept. And I said, no, we don't want to publish like that. If you really want to accept our paper, then you have to accept it as it is without making any changes. And we were little, adamant in that way, though it was risky. But then within a week or two, they replied that, okay, fine, we will accept your paper with the shloka. And slowly this kind of things will start taking place, and they have to accept Ayurveda as it is. And that will be making main difference with the acceptance level with the scientific fraternity as well. So yes, evidence-based research is necessary, not alone in other aspects, but also with these two particularly, Devyapashraya and Yuktivyapashraya and Sattva Chikitsa in this also. Then coming down to, is authentic classical Shuddha Ayurveda still relevant as it is? If not, does curriculum need to be modified suitably? What is the scope of Ayurveda research? Is RCT as research methodology applicable to understand clinical practice, Ayurvedic clinical practices? Well, again, we should not bifurcate Shuddha Ayurveda and contemporary Ayurveda. Ayurveda is Ayurveda, understand, right? But when you want to give somebody with Ayurveda along with the modern drugs and try to say that, oh, it is happening because of this, then that is something different. But whether or not, if alone Ayurvedic management can manage rheumatoid arthritis, yes, why not? And we have papers, we have got examples from your own South India. I know Dr. Ram Manohar's paper. I have seen n number of cases with my own clinic, with my colleagues' clinic, with my sir's clinic, and they are managing well. We could stop the methotrexate, we can stop HCQS and things like that. We could manage psychiatric conditions, stopping their psychiatric drugs with consultation with their ongoing psychiatrist. That we should not play with some of these drugs, because it will be difficult, it will be wrong if we abruptly stop. So you require to be in confidence, you have to take those particular clinicians in confidence and then work together. And I think slowly and steadily we can go in that direction. Whether RCT is the right methodology or not, it's a major question mark. But RCT is required for being accepted as a scientific research, and it goes to the highest level of the pyramid of the evidence base. The first one is just all information, and then the case studies, sporadic case studies, case series, and then clinical trial, then controlled clinical trial. And likewise, when it goes to RCT, randomized control trial, or even double blind randomized control trial, that becomes a really difficult task. The problem with Ayurvedic clinical trial, in particular with that of Sattva and Devapashraya, would be planning of right design and finding out the right controls, which method you should utilize for control. I remember, I'll give one example. At one of the conference I have attended at SVyasa in Bangalore itself. And one participant was mentioning about the effect of pyramid therapy, and within pyramid therapy, in that participant, the subjects were lying down throughout night, and the gadgets were placed, and they were collecting clinical data and experimental data. And next day they take their views as well, so qualitative and quantitative, either way. And Dr. Shirley Tellis and Dr. Sadbir Khalsa, who is from Harvard, and they were there as a moderator. And Dr. Khalsa sir mentioned to him, and we were also discussing in the audience, that he should have had a control, not with conical funnel shape, that is pyramid shape, but maybe covered with a box or something like that. So when a person is lying down in that particular environment for 24 say 8 hours or so at night, what could be the changes, rather than keeping him just out, like, without having any cover. And similar thing even he said. And I have read at several times that to choose the right control would be really difficult task in yoga. Same way is going to be difficult task in Sattva and Devapashan even more. But in Yuktivyapashraya, we are trying to reach out to create a much parallel with the placebo. So maybe in a form of kashayam, maybe in a form of capsules or tablets or whatever way. But then there is no point that we should not forget that n equal to 1 study means there is only one case, but that case is of very unusual manifestation, unusual cancer, very difficult to get that kind of people, that kind of patient. And on that, if you have demonstrated the effect, and if you have done it very systematically pre and post, so within that patient you can also demonstrate the result, and that n equal to 1 studies are also been accepted now worldwide. So okay, RCTs are important, but not always RCT has to be taken into consideration. Another important part I want to mention here is that sometimes in the jargon of creating clinical trial design, you tend to lose the essence of your Ayurvedic principles. So you tend to forget, designing with the parameters of Ayurvedic viewpoint. So that should not happen, and
These
that's
particular
the
points.
my take up on